Thanks for joining me again this week. This week, I joined our partners to announce a $10 million in early childhood education investments. We joined child care providers, MCPS leadership, council members, parents, and community partners to talk about how we're addressing one of the biggest challenges that families face: access to quality and affordable child care. For the first time in 59 years, Montgomery County was awarded a comprehensive Head Start and Early Head Start grant. This brings more than $6 million in federal funding and allows us for the first time to expand Head Start services to include infants and toddlers ages 0 to 3. Right now, Head Start is available for 4 and 5-year-olds. That means that families will have the support they need from the very start of their child's life. We also announced a new $4 million facility loan program for child care providers. We know providers work on very thin margins and often struggle to expand or improve their facilities. This program offers forgivable, interest-free loans to providers so they can create more infant and toddler seats and better serve families who need them most. And we launched a shared resources collaboration that gives providers access to coaching, business management tools, and collective purchasing power. By lowering costs and strengthening operations, providers can focus on what matters most: teaching and nurturing our children. All of this builds on the findings from our 2024 Child Care Supply and Demand Study, which showed that only 19% of infants and toddlers in the county had access to licensed care. That's a gap that hurts families and our economy. Without access to affordable child care, many people, and we know this is women in particular, are unable to return to work, and that hurts our local economy. These initiatives are a direct response to that challenge, and they're designed with equity in mind. As a former elementary school teacher in a high-poverty school, I knew the importance of early education and the connection to learning and success in school in the later years. For years, we talked about how many children enter the school in kindergarten 2 years behind. Think about that for a minute. That means that children are beginning schools with the capabilities of a 3-year-old rather than those of a 5-year-old, and they're not prepared to work at their age level. It's no secret that those children start behind and often stay behind, effectively preventing them from being able to be successful at grade level work, not just in kindergarten, but beyond. Brain development in those early years is critically important and impacts future growth. Early childhood education that this program will provide can help ensure that children start school ready and prepared to learn academically, but also they're socially and emotionally ready. It's not only about academics. If they don't get exposure and intervention early, it can become, and often does, a barrier to future learning. The return on investment in a young child is multiples of the return on money spent remediating learning problems when they're older. Of all the efforts and proposals to address student achievement, early childhood education is the most effective and least costly over the long term than anything else we can do. Put simply, we can fix this problem now, or we can pay for not fixing it later. Each of these programs will benefit families and, most importantly, provide children with an opportunity to build a critical foundation of early learning that will help them throughout their lives. This is a significant step forward toward universal pre-K for all county children. The Trump administration and officials have been sowing confusion and dubious claims about vaccines, and this week, Trump and his HHS Secretary, Robert F. Kennedy Jr., asserted the link between Tylenol and autism. There is no solid peer-reviewed science that supports the proposition that Tylenol causes autism. Yet it's being presented in a way that blurs the line between speculation and fact. That causes fear, chaos, and mistrust. That puts doctors in an impossible position. How do you advise someone when federal leadership seems to be issuing statements that aren't backed by science? The average person doesn't know that. To bring clarity to vaccine guidance, Maryland and other states have joined the Northeast Public Health Collaborative, a multi-state coalition to develop vaccine recommendations and other public health guidance to combat confusing and misleading messages coming from the Trump administration. The collaborative aims to help parents understand what is safe and provide information so that doctors can offer counsel based on knowledge and experience. Montgomery County stands with the Maryland Department of Health on the importance of vaccination to help reduce the burden of COVID, flu, and RSV in the community. And now, adding insult to injury, health insurance costs are going through the roof. Across the healthcare marketplaces, insurers have proposed median premium increases of about 18% for 2026. If Congress does not act to extend the enhanced premium tax credits, federal financial help that makes these plans affordable for many, they will expire at the end of 2025, and the bills for low-income earners could more than double, which could cause them to drop their health insurance. If more people drop their coverage, then they're more likely to use the most expensive health care, the emergency room at your hospital, and that's a cost that's going to be shared by all of us. So put this all together. Unscientific claims about health risks like Tylenol and autism are being made with huge visibility. Mixed or contradictory guidance about vaccines is confusing people who just want to make safe choices. And insurance costs are skyrocketing, and many people depend on those exchange plans to get basic medical care. The outcome is leading to people skipping care, delaying vaccinations or treatment, or being priced out of insurance entirely. It breaks trust, it undermines public health, and it contradicts the oath that doctors swear, which is, first, do no harm. Maybe RFK Jr. doesn't think that applies to him because he's not a doctor. But he's a public official who's supposed to be making responsible decisions, and if he's not a doctor himself, he ought to be listening to what the professionals have to say. And the professional consensus is that he's wrong. We need policy based on science, transparent evidence, and responsible communication. We need leadership that doesn't stoke fear, but instead supports patients and clinicians with clarity. When the federal government issues statements, it must be aligned with the science. And Congress needs to act so that people relying on health insurance marketplaces aren't left completely exposed by disappearing subsidies. Because without that, the confusion, cost, and harm will only grow, and the burden will fall on the most vulnerable among us. This week, our county's health officer, Dr. Davis, a practicing family physician, joined me for my media briefing and had this update.
The scientific, medical, and public health communities base their work on rigorous training, data analysis, and evidence. That expertise should not be discounted or overridden by political voices without the same experience. Health decisions deserve careful review of the best available science, not sound bites or quick fixes. My commitment to you as health officer is to provide clear, transparent information, grounded in evidence, and to keep your health and safety at the center of every decision. So I want to start, first and foremost, vaccines do not cause autism. This is the consensus of the medical and scientific community built on decades of research.
There are some notable changes in the law that take effect on Wednesday, October 1st, which impact Montgomery County and all of Maryland, ranging from new consumer protections to public safety changes. I'd like to run through a few of them now to give you an idea of what's coming. The Lowering Prescription Drug Costs for All Marylanders Now Act helps boost the power of Maryland's Prescription Drug Affordability Board. The board is able to set upper payment limits for drugs that are sold in the state and aims to bring down the cost of some of our most expensive medications. The Maryland Online Data Privacy Act will set new rules for personal data collected by companies that we do business with. The new measure would give customers the right to opt out of data sales and targeted advertising. Consumers will be able to access, correct, and delete the personal information a company collects. Data protection assessments will also be required for companies for activities that are considered high risk. Other measures will strengthen the laws against secretly recording or watching someone through surveillance videos without their permission, forcing companies that offer subscriptions with automatic renewal to provide customers with a way to cancel easily without costly penalties, and make it illegal to add medical debt to someone's credit rating. Criminal investigations into theft rings should also get a boost. New laws will aid in the prosecution of organized retail theft by allowing police to combine multiple theft incidents committed across different counties into one criminal case in any county where one theft happened. We've spent a lot of time over the last few years talking about the Sergeant Pat Kep Act, and part of that law will go onto the books in October. There will be additional penalties and points assessed against the driver convicted of reckless, negligent, or aggressive driving. The criminal justice system adds more offenses to the list of reckless and aggressive driving. Also starting on October 1st, There will be new safeguards to help vulnerable people in adult protective services systems. Confidentiality will no longer be a valid reason to not report abuse that has been witnessed. Hospitals will no longer be able to sue patients over medical debts totaling less than $500. And housing covenants won't be able to restrict the operation of family child care businesses or put undue limits on them. Landlords and property owners will be limited to no more than 5% of unpaid rent when they're assessing late charges. We're preparing our list of legislative priorities now, and that will continue over the next few months ahead of the next General Assembly session in January. I'm looking forward to the Sunday Wheaton Arts Parade. We are always working to create a welcoming, inclusive, and safe community for everyone, and the annual Arts Parade is one way we do that by highlighting the depth of talent right here in our area. Wheaton is the center of our diverse county. We are home to the highest Hispanic population in Maryland, and more than 40% of our residents were born outside the U.S. We're proud to be designated as Maryland Arts and Entertainment District, which helps produce many unique artists, creators, and restaurants whose talents are on display during the Arts Parade Festival. I enjoy how unique this parade is. It allows people from many walks of life to enjoy music, readings, and dancing. This parade brings together citizens, artists, businesses, and civic organizations, including one group that helps tie it all together with the Wheaton Yarn Bomb. We've invested heavily in Wheaton, from the $180 million Wheaton Revitalization Project to securing state aid for a future arts center and affordable housing. This event gives us a chance to celebrate Wheaton's creative side and showcase what makes it a beautiful and fascinating place to live, work, and visit. So join us starting at 10 a.m. for the parade, or visit Miriam Fryer Town Plaza through 5 p.m. to be a part of this festival. Earlier this week was Rosh Hashanah, the start of the Jewish New Year, and Yom Kippur begins sundown next Wednesday and continues until nightfall the following day, October 2nd. For the Jewish community, this is an important time marked by reflection, repentance, and reverence. It's also time to hope that the coming year is filled with personal growth and bring peace to all. Shana Tova to all who observe. So that's it for now. I'll be back again next week. Hope everybody has a good weekend, and hopefully you get out to the Wheaton Arts Parade, and I'll talk to you soon.